You swallow a pill. Boom. The chemistry of your body changes. Hey everyone, if you're new to this channel, I'm a master degree pharmacist living in Bulgaria who is enjoying creating topics related to drugs, pharmacology, and medicine. I am aiming to educate and inform people around the world with less knowledge and to share my experience with other medical specialists in the endless ocean of medicine and pharmacy. Today we're diving into the beautiful land of pharmacology in just 10 minutes. Pharmacology in 10 minutes? What the heck are you talking about? Let's get into it. What is pharmacology? Pharmacology is the study of how drugs interact with your body and how your body interacts with drugs. It's not just what you take, it's how it works, where it goes, how long it lasts, and what else it affects. So we're going to break it down into 4 parts. Part 1. Pharmacokinetics. What your body does to the drug. This describes the journey of the drug as it moves through your body from the time it enters until the time it leaves. So let's follow along with this magic pill here. First, there's absorption. How the drug gets in. The easiest way for a drug to get into your bloodstream is if it dissolves in the water that makes up most of your body. But depending on the drug, it may start off as a pill, a liquid, an injection, or even a cream. You see, some parts of your body are better at absorbing certain types of drugs. For example, your stomach is great at absorbing pills, but not so great at absorbing creams. And your skin is great at absorbing creams, but not so great at absorbing pills. That's why you got to put them on the right place. Once it's absorbed, the drug gets distributed all throughout the body via the blood. Not every part of your body is equally accessible to every drug, though. Some drugs can't cross the protective blood-brain barrier, while others can't dissolve in fat, so they can't get into fatty tissues. If you remember anything from this video, let it be this. Pharmacology is the science of how drugs move through your body and change it. For better or worse, after distribution comes metabolism, how the liver breaks it down. The liver is like the drug's worst nightmare. It has a bunch of enzymes that modify or metabolize drugs in ways that make them easier to excrete out of the body. Most drugs aren't exactly in their final form when they enter the body. For example, some are inactive so-called prodrugs and need to be activated by the liver before they can do their thing. Or some are too active, and the liver will metabolize them to make them less strong. In general, the goal of metabolism is to make the drug more water-soluble, so it can be eliminated through urine or poop or even breath. And lastly, we have excretion, how it leaves. All the roots of excretion are basically just fancy ways of getting rid of the drug. Through urine or poop or breath, the drug is now out of the body, and our job is done, at least for pharmacokinetics. Now we got to talk about pharmacodynamics. Part 2. What the drug does to your body. This is all about how the drug interacts with the body to produce its effect. Remember our friend the pill? Now it's time for it to do its job. When a drug causes an effect, it usually binds to something in the body, such as a cell or a receptor or a molecule, which then triggers a series of biochemical reactions leading to the desired outcome. For example, caffeine, the stuff that keeps you up, actually blocks the effects of adenosine, a neurotransmitter that makes you tired. By blocking adenosine, caffeine prevents drowsiness and increases alertness. Morphine, the powerful painkiller, activates opioid receptors in the central nervous system, which reduces the perception of pain. And finally, we have antidepressants, which block the reuptake of serotonin, a neurotransmitter that regulates mood. By blocking reuptake, more serotonin is available in the synapse, which ultimately improves mood. As you can see, the same drug can have multiple effects. That's because a lot of things in the body are interconnected, and one change can cause a cascade of other changes. This can be good, like if you take a drug for pain that also improves your mood. But this can also be bad, like if you take a drug for nausea that ends up lowering your blood pressure too much. Hence the reason why many drugs have a long list of possible side effects. Speaking of side effects, let's move on to part 3. Side effects and interactions. The panacea does not exist, or in other words, no drug is perfect. Some bind to the wrong thing, that's a side effect. Or they mess with other drugs. That's an interaction, like grapefruit juice. Healthy, refreshing, and secretly sabotaging your medication. Okay, typical example of food-drug interaction. It blocks an enzyme in the liver called CYP3A4, the one that breaks down tons of common drugs. So instead of your body processing the drug, it gets overloaded. Result, side effects go through the roof. All from one glass of juice. So next time you're on meds, check if that innocent grapefruit is your drug's worst enemy. Also keep in mind that people can react differently to the same drug. Some people might have no side effects whatsoever, while others might have tons. And the reason for that is part 4. Why it matters. A drug that works great for one person might not work as well for another. And there are many factors that influence how a person reacts to a drug. For example, body weight and composition, genetics, age, diseases, and other drugs that the person is taking. We already talked about how different routes of administration can affect how a drug is absorbed and distributed. But another thing that can affect a drug's journey through the body is the formulation of the drug itself. For example, if you have a headache, you might reach for some ibuprofen and pop to pills. Now, you could crush those pills and take them in a glass of water, but it probably wouldn't taste good. And crushing the pill could also destroy the coating that controls how fast the drug is released in the body. This can lead to higher levels of the drug in the body than intended, which can increase the risk of side effects. And here's another fun fact. Antibiotics don't work on viruses. These are different types of infections caused by different types of pathogens. Antibiotics target bacteria while antivirals target viruses. Taking the wrong medication won't treat the infection and could even make things worse by increasing antibiotic resistance. That's why it's so important to follow the instructions on the bottle and to consult with a doctor or pharmacist for future use. And remember, the dose makes the poison. Doses sola facit, venenum, Paracelsus. The right drug at the right dose can work wonders. But the same drug in the wrong dose can be dangerous. For example, a small dose of epinephrine can save a life during a severe allergic reaction, but a larger dose can cause the heart to stop beating. Timing is also crucial. For example, some drugs need to be taken on an empty stomach to be absorbed properly, while others should be taken with food to reduce side effects. And then there are some drugs that should never be crushed or chewed, such as extended-release pills, because doing so can change the way the drug is absorbed in the body, leading to potential problems. Every pill, every drop, every dose is more than just chemistry. It's a negotiation between science and your body. Pharmacology isn't just about how drugs work, it's about how you work. And the more you understand it, the more power you have over your own health. Curious what happens when drugs go wrong? Expect more videos on this topic. Having a specific question about pharmacy and medicine? Feel free to ask in the comments. See ya.